If you're taking amlodipine right now, stop for just a moment, because what I'm about to show you is something most adults over 50 are never told clearly, not because anyone is hiding it, but because prescription appointments simply don't have enough time to explain the full picture, and that gap is where most of the problems begin. Amlodipine is one of the most commonly used blood pressure medications in the world. It helps relax your blood vessels, making it easier for your heart to push blood through your body. Simple idea, powerful effect. But here's the part most people never hear. This medication doesn't just work in isolation, it reacts with your everyday habits, foods, and even decisions you don't think twice about. And in adults over 50, those small interactions can quietly change how your body responds, sometimes in ways that show up as dizziness, swelling, or unexpected blood pressure changes. Here at Strong 50s, we go beyond the prescription label and look at what daily life actually does to the medication inside your body. And in this video, I'm going to walk you through 5 specific things you should avoid or be careful with if you are taking amlodipine. Not vague advice, not fear-based warnings, just clear, research-informed explanations in simple language. By the end, you'll understand why some people feel fine for months, then suddenly develop side effects, why certain normal habits can quietly interfere with blood pressure control, and how small adjustments can make your treatment much more stable. And stay with me until the end, because the 5th point connects everything together in a way most people never realize, even after years on this medication. Now let's make this very clear. This video is not here to tell you to stop or change anything on your own. It's here to help you understand your body better so you can have a more informed conversation with your doctor. Because when you understand what's happening inside your system, you stop feeling confused by it. Think of your blood circulation like a city water system. Your heart is the pump, your arteries are the pipes, and your blood pressure medication, like amlodipine, is designed to slightly widen those pipes, so the flow is smoother and safer. But here's the important part. When you change pressure, flow, or resistance anywhere in the system, the whole network responds. That means food can influence absorption, other medications can change effectiveness, and daily habits can shift pressure unexpectedly. And this is why 2 people on the same dose can have completely different experiences. One feels perfect, the other feels dizzy or swollen. Same medication, different life variables. That's what we're breaking down today. Amlodipine is generally considered effective, well-tolerated, and long-acting. But well-tolerated does not mean no interactions. It simply means most effects are predictable, if nothing else in your routine is changing. The reality is, after 50, your body is already changing. Kidney efficiency shifts slightly. Circulation becomes more sensitive. Hydration levels matter more. And inflammation patterns become more noticeable. So the same medication behaves slightly differently than it did in your 30s or 40s. Not worse, just more sensitive. And that's where these 5 points become important. We're going to break this into 5 simple real-world areas. 1. A common food interaction most people don't expect. 2. A sudden habit that can backfire on blood pressure. 3. A daily situation that quietly affects circulation. 4. A pain medication combination many people use without thinking. 5. A side effect reaction that leads to the biggest mistake of all. Each one is simple on its own, but together, they explain almost every unexpected issue people report with this medication. Now, before we continue, take a second and hit the like button if this is already making sense. It really helps Strong 50s reach more adults over 50 who want clear, simple health explanations like this. And I want to hear from you in the comments. Where are you watching from and what age group are you in? 50s, 60s, or 70 plus? It helps build a real community here where people learn from each other's experiences. All right, let's move into the first thing you need to know. Now, let's go into the 5 things you need to be careful about if you are taking amlodipine. Remember, none of these are random or theoretical. These are real-world patterns seen in adults over 50, and each one connects directly to how this medication behaves inside your body. Thing 1. Grapefruit and certain citrus foods. Let's start with something many people consider completely harmless: grapefruit and grapefruit juice. On the surface, this looks like a healthy breakfast choice. natural, vitamin-rich, and often recommended in general nutrition advice. But here's what changes when amlodipine enters the picture. Amlodipine is processed in your liver using enzymes that control how quickly the drug is broken down and removed from your body. Grapefruit contains natural compounds that interfere with this enzyme system. In simple terms, your body becomes slower at breaking down the medication. So instead of leaving your system at a steady, controlled rate, more of it stays active in your bloodstream for longer than intended. This can increase the effect of the medication in some people, and that's when symptoms like light dizziness, flushing, unusual fatigue, or lower than usual blood pressure can appear. Think of it like a processing exit door in your body. Grapefruit partially blocks that exit, so the medication stays longer than planned. What to do instead? If you are regularly taking amlodipine, it's generally safer to avoid grapefruit and grapefruit juice unless your doctor advises otherwise. Thing 2. Stopping the medication suddenly. This is one of the most important and misunderstood points. Some people stop taking amlodipine suddenly when they feel better, experience side effects, or simply forget to refill their prescription. On the surface, this seems harmless. But inside the body, the change is significant. Amlodipine works by relaxing and widening blood vessels. Over time, your body adapts to this steady state. When the medication is suddenly stopped, your blood vessels do not instantly return to normal balance. In some people, they can temporarily tighten more than expected before stabilizing again. This is called a rebound effect. In simple terms, your body gets used to support and then suddenly loses it. This can lead to sudden spikes in blood pressure, headaches, or pressure sensations, feeling unwell or off, and in some cases, increased cardiovascular stress. Think of it like releasing a stretched elastic band. If released slowly, it settles smoothly. If released suddenly, it snaps back quickly and overshoots before stabilizing. What to do instead? Never stop amlodipine suddenly without medical advice. If changes are needed, your doctor may adjust your dose gradually or switch you safely to another medication. Thing 3. Long periods of standing still. This one surprises many people because it has nothing to do with food or medicine. It has to do with how you stand and move during the day. When you stand still for long periods, like waiting in a queue, cooking, or attending a gathering, your calf muscles are not actively helping push blood back up toward your heart. At the same time, amlodipine relaxes blood vessels, especially in the lower body, so blood can pool more easily in the legs. This may lead to ankle or foot swelling, heaviness in the legs, lightheadedness when you start walking suddenly, or feeling slightly unsteady after standing too long. Think of circulation like a return system. Walking keeps it active. Standing still slows it down. When combined with a medication that relaxes vessel tone, pooling becomes more noticeable. What to do instead? If you are standing for long periods, gently shift your weight, move your calves, or take small steps when possible. And when you start moving again, do it gradually instead of suddenly. Now, the fourth point is where many people are completely unaware of the interaction, because it involves a very common pain relief medication used worldwide. Let's move into that next. Thing 4. Common pain relievers, NSAIDs like ibuprofen. Now let's talk about something extremely common, pain relief tablets like ibuprofen and similar anti-inflammatory medications. Many people use them for joint pain, back pain, arthritis, or general body aches, and most of the time they are taken without a second thought. But here's what matters when you are also taking amlodipine. These pain relief medications work by affecting chemicals in your body called prostaglandins. These chemicals help regulate inflammation, but they also play a role in how your kidneys handle salt and water. When prostaglandins are reduced, your body tends to retain more sodium and fluid. Now combine that with amlodipine, which is already working to lower blood pressure by relaxing blood vessels. The result is a kind of internal conflict. One medication is trying to lower pressure, the other is indirectly making it harder to control pressure. Over time, this can reduce how effective amlodipine feels in some people. You might notice blood pressure readings slowly creeping up, mild swelling in feet or ankles, or less stable control than before. Think of it like a water system. Amlodipine widens the pipe to improve flow, pain relief, NSAIDs partially tighten the system from another point, so the flow doesn't become dangerous suddenly, but it becomes less efficient over time. What to do instead? If you need occasional pain relief, it's worth discussing safer alternatives with your doctor. And if you are using these medications regularly, it becomes especially important to review your combination rather than self-managing long-term use. Thing 5. Stopping because of ankle swelling. Now we come to the most important point, because this is where many people unintentionally create the biggest problem. Amlodipine can sometimes cause ankle or leg swelling. This happens because blood vessels in the lower body relax, allowing a bit more fluid to move into surrounding tissues. For many people, this is mild manageable and not dangerous, but it is visible. And that visibility creates concern. People notice shoes feeling tighter, ankles looking puffier, discomfort in warm weather, and without knowing the mechanism behind it, many assume this medication is causing harm. I should stop it. So they quietly stop taking it, sometimes for a few days, sometimes completely. And this is where the problem becomes serious, because when amlodipine is stopped suddenly, the body can react with a rebound effect. Blood vessels tighten more than expected, and blood pressure can rise sharply. So now you have a situation where the visible issue, swelling, is uncomfortable but usually manageable, but the result of stopping, blood pressure spike, can be much more dangerous. This is the key misunderstanding. To make it real, many people think they are solving a problem by stopping the medication, but in reality, they are sometimes replacing a visible issue with an invisible one. What to do instead? Ankle swelling should always be discussed with your doctor before making any decision. Often, it can be managed with dose adjustment, timing changes, or combination treatment strategies. There is almost always a safer adjustment than stopping suddenly. So let's bring this together. If you are taking amlodipine, the 5 key things to be aware of are: grapefruit can slow how your body processes the medication. Stopping suddenly can cause a rebound blood pressure effect. Long periods of standing still can worsen swelling and dizziness. Common pain relievers like ibuprofen can reduce blood pressure control. Stopping the medication due to swelling can create a more serious risk. Individually, none of these look dramatic, but together they explain why some people feel stable for months and then suddenly experience changes they didn't expect. Amlodipine is a widely used and effective medication when used consistently and correctly. The goal is not fear, the goal is awareness. Because when you understand how your daily habits interact with your medication, you make better decisions, not alone, but in partnership with your healthcare provider. If this helped you understand things more clearly, take a second to like the video. It really helps Strong 50s reach more adults who need simple, clear health explanations like this. And I want to hear from you in the comments. What age group are you in? 50s, 60s, or 70 plus? And where are you watching from? It helps build a real community here where people learn from each other's experiences. If you're new here, subscribe to Strong 50s because we break down real health topics into simple, practical understanding without confusion or fear. This content is for educational purposes only and is not a substitute for professional medical advice. Always talk to your doctor before making any changes to your medication, diet, or treatment plan. Your health, your understanding, your control. We'll see you in the